ones that are here. Thank you, everyone that's here. I'm Linda Cassell, and I'm excited to have Dr. Leah Johnson, and she's known in the cannabis community as Dr. Leah. She's very well known, rather famous, in fact. She's a clinical cannabis pharmacist and the owner of CEO of Alchemist, as I pronounce that, Cannabis Consulting, and she is well spoken and cannabis lecturer across the country and in high demand. So I'm very grateful that she had the opportunity to join us today.
I'm thrilled to be here. Please feel free to unmute and ask questions as I go, especially because there's not very many of us. So please feel free. I know that questions come up all the time, and even if it's not on the subject we're talking about, because heck, I'm here, might as well ask me, and I'm happy to answer. So I was going to start my discussion actually with Delta 8, because I just thought that was a big thing going around right now. A lot of questions about it, a lot of unknown knowledge about what Delta 8 is. Is it like THC? Is it the same thing as THC? And where do we go from here? And, so I'm going to explain a little bit about Delta 8, but I'm also going to kind of give I will put my biased opinion on it, because that's why I'm here, but specifically based on the lack of research on it. So Delta 8 is actually a minor cannabinoid that is found naturally in the plant, but in very, very, very minimal amounts. So what we consider THC is actually Delta 9 THC is its proper name. So Delta 8 is Delta 8 THC. So Delta THC, so Delta 9 THC or Delta 9 is very prevalent. It's the after decarboxylation, meaning once you move it from the plant, which has it from the acid, and move it over, what you get is THC is usually the highest, Delta 9. But Delta 8, like I said, is found in very, very, very small amounts in the plant. So what's happened is that in many states without the regulation to allow THC, and even in states that allow THC, people started creating Delta 8 products. And that's why I like to talk about it, because a lot of people question, is it a synthetic THC? Is it a synthetic cannabinoid? Where does it come from? So it can be extracted naturally from the plant, but most products are not, because the amount of plant material you would have to use to extract it is a lot. And it's a huge waste of material to use for a small amount. So most of the time it's actually used by converting it from CBD to Delta 8 using an acid. Acetic acid is often used, but also is sulfuric acid. So a lot of people get very nervous because of the sulfuric acid, as do I. But again, knowing chemistry and everything, as long as you know how to wash it out properly, you're all set. The biggest question is, do these manufacturers of Delta 8 know how to remove and to wash out the sulfuric acid properly from these products? So the way it actually gets usually made is CBD flower in again, either acetic acid or sulfuric acid. And if you let it sit there for about a couple hours, you're actually going to produce THC. And then once you actually get to the THC level, then you would then keep it in the sulfuric acid, and it gets converted actually to Delta 8 after about a few weeks. So Delta 8, when it gets processed naturally in the plant, is actually when it's converted from THC to CBN. So THC is a natural cannabinoid in the plant, as well as CBN. CBN is the oxidized form of the THC. So when THC is oxidized, it gets to CBN. So that's why a lot of patients who use flower for medication will say, I left my flower out for a long time, and, it's just kind of been sitting there, and it's kind of old, and it kind of looks a little brown, kind of like fruit will start turning brown once it's cut open, because again, that's also the oxidation. So what happens when it oxidizes, it goes from it goes from THC to CBN. And the CBN actually has more of I wouldn't call them sedative, but I would call them more sleepy effects. You feel a little bit more tired and a little bit more relaxed mentally, as opposed to the THC, which kind of some people can actually rev up depending on how their body converts the chemical. So from here, so there are many products, like I said, on the market with Delta 8. I always, again, I'm very hesitant about them because of the fact that not only, even if they are made very well and made without, with all chemicals removed at the end, we don't have any current studies showing the high doses of Delta 8 in our body and what they will do for us. We have lots of research about THC in high, in different doses in the human body and how it actually integrates with our endocannabinoid system. But for Delta 8, we do not. So we know naturally it only comes in very, very insignificant amounts in the plant. So we need to get more research to really learn. So I always tell people that if you're in a state that can get THC, stick with THC. There's a lot more research on it, and you can always help in like alter your THC if you find it's a little bit too sedating for you. All you have to do is bring down the dose. So if you're seeing, you tried a 5 milligram gummy and you're like, oh my heavens, that makes me want to sleep for a couple hours. All you have to do is cut it in half, cut it in a quarter, find out what dose is right for you. And I always encourage CBD to be added to that therapy because it's a good balance. CBD is, I like to say that it's like the traffic guard of the endocannabinoid system. It tells everything where to go, when to go, how to get there. So it really gets a good balance of everything. So that's really my topic about Delta 8 is again, until we have more research, I don't recommend it. And I definitely recommend to go with the authentic THC. It is very difficult in states like, like Texas is a great example where they don't allow THC and they're now actually starting.
Because it's not only just this personal relationship, it's our national relationship with the country that she leads and how that is influenced. And so.
Okay, perfect. Thanks, honey. That's pretty much my background about the Delta 8 is the fact that for right now, I don't recommend it because we don't have enough research. And for the most part, in many instances, it is made synthetically. So the last thing I was going to say actually about Delta 8 is a lot of people will actually say to me, but I'm smoking Delta 8 flower. I've actually purchased Delta 8 flower from a lot of these companies that sell CBD. How is that possible? And I explain, you're actually not smoking Delta 8 flower. You're actually smoking CBD flower that's been sprayed with Delta 8 concentrate. So that's where the confusion comes in is you are smoking flower, but it's actually originally CBD flower that has a spray on it that is Delta 8. So again, for the most part, I would say, stick with the THC if possible. And I'm sorry for states like Texas that don't have the access to the THC like they should. But that's what we should be fighting for in those states is not to allow other chemicals to be approved, but to make sure that the good cannabinoids that we know are effective are, being able to be utilized by anybody. So if anybody has any questions, I'll field those before I move on to CBG. Okay. So no questions, feel free. And if you guys do have questions and you just don't feel like asking them outright, feel free to throw them in the chat and we can get back to them at the end as well. So the next thing I wanted to talk about was CBG. So CBG, actually CBGA. So in the plant, everything is pretty much in its acid form. So you have CBGA, and CBGA is actually called the mother of all cannabinoids because it kind of is. CBGA produces CBDA and THCA, so it produces the acid forms of both. Then when cannabis is decarboxylized, and you do that by heating, by smoking, so anything that heats the product, it has to get to about 250 to 300 degrees Fahrenheit for decarboxylation to happen. So you could do it through vaping where you don't have to worry about the combustibility, and so it's not causing that tar. But you can also do it by also just heating it you do it as long as it's heated to about 250, 300. And then you produce the actual active ingredients that we see when we consume it, which is THC, CBG, and CBD, and all the other cannabinoids. You could actually get the raw cannabinoids in regular products. You can get the acid forms, and the acid forms do not cause the psychoactive properties. A lot of patients are a little nervous, like, oh, I don't want psychoactive properties, meaning ones that affect the brain, but I do want to have, but I've read a lot about THCA and it looks great. And people get a little nervous, and I explain to them that our bodies aren't able to heat up the cannabinoids enough. So if you are actually ingesting a THCA product and it says THCA on it, as long as you're not lighting it and you're just either it's an edible or a tincture and you're swallowing it, your body will get the THCA and it won't convert it to the THC. That doesn't mean that it won't potentially show up on a drug test. So you do want to always be careful if you are somebody who is drug tested by the government or by your work. But you won't actually, but that's more in the metabolites of it. It's not what your body will feel. Your body will feel the THCA, which is the anti-inflammatory effects and the calming effects. So all in all, that's why. So back to CBG. So CBG is a great cannabinoid. It does a lot of, it's really beneficial for blood pressure, for just overall calmness. And it has other really great properties that have been actually researched in studies. More studies obviously are coming out because CBG is one of the newer cannabinoids that people are putting a lot of effort to researching. The reason why I like talking about CBG is because of its effectiveness. It becomes so effective to a lot of patients that they are excited about the effect of the cannabinoid, but they don't think about the fact that if they're on other medications, it can interact with the CBG. So, I always warn about, I had a colleague whose spouse, sadly, the spouse had taken CBG, had been doing wonderful. And what happened was he didn't tell his doctor, by the way, or physician or provider, that I am using CBG. So the provider had no idea what to do. So this gentleman, he had gone to bed, had used his insulin like he normally did. Ended up that my colleague found him unresponsive, and he had to get he had to get taken to the hospital because he was completely unresponsive due to the fact that his blood sugar had dropped down so low. And I've actually heard I personally have not seen this, but I have also heard of instances where CBD has dropped patients' blood pressure very low. So the reason I mentioned CBG is because it's a great cannabinoid. It's definitely something that people should utilize. So if you see it in a product, definitely don't be hesitant about it. It's very helpful. However, if you're on medications to balance out your system, whether it's blood glucose, your blood sugar, or your blood pressure, make sure that your provider knows what you're taking, and make sure you test yourself more, because the last thing you want to do is to, end up having such a great effect from your cannabinoid therapy that it actually ends up hurting your medicinal therapy or your prescription therapy. So the best thing is you can actually start utilizing CBG, CBD, and the other cannabinoids, and they will help. So as you balance back and forth with your provider to look at your levels, you might be able to actually reduce your insulin, reduce your blood pressure medication based on the use of these cannabinoids. So again, that's why it's always a handheld teamwork approach for cannabinoid therapy, because the provider always should know what's going into your system that might be affecting the medications you're on. So I'm a huge fan of CBG. I think it's very effective. But again, my biggest take home for CBG is just to be very, very careful about about making sure you monitor yourself while you're taking. And that goes really for any herbal, any therapy, because another thing that people don't know about cannabinoid therapy is that it actually goes through the liver. It gets broken down through the liver the same way that a lot of other medications are broken down. So they call this the cytochrome P450 system. So this is also known as the CYPs. So CYP3A4, for example, is a CYP that is well known for breaking down statins. There's like specifically atorvastatin and lovastatin and simvastatin. So, it's really, so when you're taking other cannabinoids or other therapies that interact with this, what happens is the body then has to decide, what am I breaking down first? Am I breaking down this statin first, or am I breaking down this cannabinoid first? And sometimes it depends on which one has more affinity for it. And sometimes it depends on which got there first. So for example, if you were to then have your cannabinoid therapy get broken down first, that means your statin therapy has a higher level in the system and it's just hanging out there. And the last thing we all need, I'm sure, Linda, as a nurse, like, you don't want high levels of statins hanging around in the body. Statins are very effective and they can be great to help you with cholesterol therapy, but the side effects would get increased if you're using other therapies that use the same enzyme, the same mechanism to get broken down and excreted from the body. So that's why it's, again, always so important to make sure that if you're working with a healthcare professional that understands cannabis, or at least healthcare professional that understands you need to be monitored to prevent these, to be able to potentially reduce the medications. Bless you. So that's the most important thing, is just to be careful and to make sure that your therapy is monitored. The last thing that I would like to talk about today is CBN. And recently, CBN has kind of gone both ways. Originally about a year or so ago to maybe 2 years, it was like touted and everybody was all about CBN. And then a lot of research came out that said CBN doesn't work. And then, but then a lot of patients said it did work. And then you had patients that said it didn't work. So there is so much confusion about CBN. So it's not, so we, first off, need a lot of we still need a lot of studies in CBN. But the biggest thing is, I find that the biggest difference is how to utilize the CBN. It's not as simple as the chemical, but it's also how you use it and what type of patient you're using it with. If you're using it on a patient that's THC naive, they've never had THC or potentially other cannabinoids in their system, CBN can be very effective for kind of in the same concept as almost like melatonin. Melatonin really should be used for your sleep cycle and to help with your circadian rhythm, but CBN can also kind of help the way that people use melatonin to kind of feel that kind of, not sedation again, but more of just the, you kind of feel yourself kind of getting a little bit not sleepy, but kind of relaxed. And CBN can do the same thing. What I do find what I really do find for CBN is more difficult with its THC or cannabis non-naive patients, the patients who have used cannabis before. And what I've noticed is, first off, there are a lot of products out there with CBD and CBN. You have to know how your system reacts to cannabinoids before you can make a decision on what to use. The reason I say that is because a lot of patients, CBD actually keeps them awake. I use CBD therapy during the day for my, specifically for physical relaxation of my body for the injuries I have in it. So the CBD doesn't affect my brain at all, but it does physically make my body relax. However, it also makes me alert. It also makes me more focused. It actually really helps me for my ADD. So it keeps me on task. And as you can see, I'm a little bit over that. So, obviously I need a little bit more CBD. But the biggest thing though, is the fact to really know, what CBD does for you before utilizing it in a therapy. So I mentioned that because there are a lot of CBN products on the market that are CBD based, meaning that you can buy them, you could ship them over in the mail, you can buy them, over the internet, and they'll be high CBD. And I have patients that say, why are they, what is this? I tried this and it doesn't work at all. Obviously CBN doesn't work. And my response is, have you tried CBD alone for sleep? And if their answer is no, then it's like, there's a good chance the CBD is actually what's causing the issue. So, the biggest thing you want to do is you want to make sure that you are seeing how CBD affects you before you have a CBD and CBN therapy. For those who are cannabis naive, CBN alone could be, has the potential to be very effective. For those who use THC, the way I explain it is, I personally, and this is again more anecdotal because more research needs to be done, I see CBN as a way to stay asleep, not to knock you out, but a way to really stay asleep and to help improve your sleep. So I see for those who are THC users, THC itself, the inhaled THC, is really the best way to kind of get that mental relaxation, especially if your insomnia is due to anxiety. You definitely want to quiet your brain. So THC is great for that. And then the CBN is enough to keep you asleep throughout the night. So what I always encourage people is, if you've tried CBN alone, or if you've tried CBN with CBD, if you do take THC, try THC first in whatever form you usually take it in, whether it's a edible tincture, so on and so forth. But then make sure that you progress in and make sure that you take the CBN about an hour before bed, enough to kind of start helping you with your sleep cycle, but to also keep you sleeping throughout the night. And I found that I found with patients that I've tried. I actually did my own little, not really experiment, but kind of an experiment. Nothing I would obviously write about, but I tried patients with CBD and THC and CBN therapy, along with alone, and then CBN therapy alone. And what I found is that some of the patients, especially with anxiety, the edible with the CBN and the THC sometimes would still trigger their anxiety in the morning. And that would give them a little too much THC, because a little bit too much THC can actually trigger anxiety for some patients. So what I found with the THC before bed and then the CBN as the edible with, or the tincture or edible with sleep, it keeps you sleeping, and it's really, really effective. So there's still a lot of questions out there about it, but CBN's great for those who have flower, who are flower patients, and for those who don't use cannabis, flower is another term for the street terms for bud or weed, or what's traditionally thought of as marijuana. And what I don't personally use any of those terms because I stick with the chemical term of cannabis. But what you find is that for people who actually use flower, who want a better sleep, any strand, it's not a strand-based conversion, it's a chemical-based conversion just through straight oxidation. In other words, leaving your flower up to the air so that the air can oxidize the flower. And again, like I said, you're going to see it get kind of rusty, starting to get rusty colored, because that's what the oxidation does. And then what you'll find is, and a lot of, I laugh because a lot of patients will say, that makes, I found some cannabis that I haven't smoked in forever. And I looked at it and I smoked it. And oh my God, I was so much more sleepy from it than originally. And it's like, yes, because you let it oxidize, meaning that all the THC has now been, not all, a lot of the THC is being converted to that CBN. So it is more helpful for sleep than it would be otherwise. So that's why, and the biggest thing you'll ever hear me say is I am not a strain-based person. And the reason I say that is because there's a difference. So strains are also known as chemovars. And what you find from different chemovars is you can have seeds from the same chemovar and grow them in the exact same condition. And once you test the chemical properties of the flower you produce, you can get all over the place, which is kind of makes sense if you think about it. Think of your siblings. I have many siblings, especially me and my sister. We have the same mother. We have the same father. We look similar, but we are very different people. It's actually the same thing it's the same way of seeing strains. Is there are times where people say, I used this strain and it worked great, but then I used it again and it didn't work great. Why did it not work great? And the answer is because the way that the plant developed and what it produced and the genetics that it came out with are not going to be the same plant to plant to plant to plant. The only time you'll get similar genetics is actually if you use clones, because then you're using one parent plant and you're taking bits and pieces off that parent plant, and then those clones would have the same phenotype and as each other. In other words, they will look and act the same. But when it's different seeds from the same plant, just like different babies from the same two parents, they can be very, very different. So when I help patients with therapy, I never stick on strains. I always stick on the quantity of CBD and the quantity of THC and the quantity of the other cannabinoids and terpenes in the flower or in the product. So for just quickly, because I know I said terpenes and people might not know, terpenes are what we call the flavor and smell components of really anything, really, but in this case, in cannabis. So the terpenes, again, and there are terpenes in fruits and vegetables. It's what gives the fruits and vegetables their flavor. So for example, limonene is a terpene that is found in a few strains. And it kind of has an orangey kind of citrusy flavor. And the purpose of it is, or not purpose, but its benefits are very helpful for depression. So it's so great for depression. But the problem is I've had patients say, I use the same exact strain, but it's not coming, it doesn't affect me the same. And then I said, I always ask them, does it smell and taste the same way as the last one did? And very often I'll get no. My last one was so orangey smelling or so lemon smelling, and this kind of just smells like general cannabis. There's no real flavor profile to it or scent profile. And a lot of times that's just because that plant did not produce what you were looking for. And that's why the answer is don't go for your, don't stick with your strains. You really want to see what's in them. So the best model I like, and it's not in my state, sadly, not in California, but in Connecticut, is my favorite model of a packaging, because they require every single cannabinoid and every single terpene to actually be on the packaging for every product. And the reason why that's so important is because if a patient says this profile works for me, then it doesn't matter what it's called. They look for the bud tenders or the pharmacist, depending, in Connecticut it is pharmacists and bud tenders. They can look on the shelf and actually do a side-by-side comparison and say, you brought me this, you tried this, you liked it, you said this worked good. This has, it's not the same strain, but it has about the same percentage of terpenes you're looking for. It's got the same types of terpenes, and it's got these levels of cannabinoids that are very similar. And what the patients find is it helps them actually decide on a flower base, which is the best flower for them. For patients who use products, it's a little easier, but it is nice because a lot of products are made by isolates, meaning that you might have an isolate of CBD and an isolate of THC and an isolate of CBN. But again, it's not the whole plant. You're missing the protectiveness and the benefits of getting the entire plant there. And that's why I always explain to patients, even if you're getting a CBD product with only 0.3% THC, I always recommend full spectrum. You really want the full spectrum because that's every part of the plant that's been extracted, and the plant is beneficial as a whole. So there's a lot to learn about cannabinoids. There's still a lot that we need to learn about cannabinoids, but and you will hear me say both cannabinoids and cannabinoids. I don't know which is the right way. I've heard both. It's acceptable. So don't quote me on that because I'm a pharmacist and I still say metoprolol and many people say metoprolol. So that's its own thing. But, but the biggest thing is the plant. So I did see a couple questions. So let me just quickly go into there and make sure I don't miss anything. So okay, so the first question was an anti-inflammatory for somebody who is cannabis naive and not used to any sort of cannabis. So I always say first step is always CBD. I always recommend always start with a CBD. And the biggest thing is to know where you're getting your CBD from, because there are hundreds of companies that sell CBD and so many products are really, really not effective. And I know firsthand because I actually I tested a ton of CBD products until I found ones that were effective. So I could say, I mean, I am not affiliated with any company. I will say My Jane is a great broad spectrum, meaning that it does not have any THC in it. It's a great broad spectrum because it has essential oils in it. It's got essential orange oil and essential cinnamon oil. And the nice thing about the essential oils is it actually helps the bioavailability, which means it helps it get into your system better. So it really does help with the benefit of helping with the anti-inflammatory effect and everything. But the biggest thing is, again, it is broad spectrum. And this is really great for people who have any potential. It's like if you even think or worry about getting tested, you should stick with a broad spectrum because that way it should not have this, and make sure it says no THC in it. You always want to be careful because you have to trust your company. But for example, My Jane is a company you can use. That's broad spectrum. There are a lot of also full spectrum companies. And that's usually what I like to recommend for people because, again, you really want all the benefits of the plant. A lot of people are nervous about full spectrum, afraid that the THC will affect them. In these types of products, the THC is in such insignificant amounts. It's the 0.3% THC. You're not going to feel that THC. You're going to feel you might feel physically like, oh, my shoulders are relaxed. I used to have like really, I could feel the inflammation, and stress in my hands and my back and my neck and my joints. And you will get rid of that. And you don't need to worry about the side effect. Now, again, it all depends on testing. Testing, you do need to be very careful about. But if you're not worried about getting testing, the best really to start off with is a full spectrum CBD product. So like I said, so the broad spectrum would be MyJane is the one, is just an example of one. There are other, and there are many companies that do full spectrum. I would say that I do for full spectrum, I mean, there's actually so many. So like, I don't want to list, but there are good ones, but feel free to reach out to me if you have questions though, because if you want to ask if it's a good one, I just don't want to like feel like I left out a company and have them say, hey, you didn't mention me. Only reason I mentioned MyJane is only because they are one of the few broad spectrums that I think are really effective. The other one is, I will also say that broad spectrum gummies from HempWorks are also very, very effective to use, again, if you're wanting the broad spectrum and not the full spectrum. So I hope that explains about CBD for inflammation. THC works amazingly for inflammation too. You just need to know how to balance it out to make sure that you're using enough CBD to your THC. To be honest, I'm a full believer that I would always put the CBD level always higher than the THC for daytime use. The only time I would ever put THC use above or only would be nighttime use. And that's because if people have gotten used to THC therapy, if you use CBD or some of the other cannabinoids at night, they might be able to keep you up. So so basically for inflammation, that's what I'd go. So all CBD, yeah. So, and that's another big thing. A lot of people have touted that certain cannabinoids and certain strains are better than other. Cannabinoids are cannabinoids. They, if it's CBG, it's CBG, whether it's from a white willow, like a Charlotte's Web plant versus this plant versus that name of a chemovar, whatever, Hawaiian haze, whatever you want to call the plant. CBD is CBD is CBD. CBG is CBG is CBG, and CBN is, and so on and so forth. They are what they are. And that's why I never, ever, ever go by strain because, again, like I said, strains change. And the biggest thing is to find out what works for you. So I always have with patients, I work with them. And that's the biggest thing to taper. Oh, you're a little bit too energized from this. Okay, let's pull down on the CBD a little bit. Oh, you're a little, you feel a little sleepy. Okay, let's either pull down the THC or let's actually up the CBD. So it really just depends on like what you're looking for. Okay, so I just want to make sure. I do know he left, but I do want to still answer his question if it's here. So yeah, so that's the other. And so one of the people that were actually on that had bounced off, had jumped off, said that it's a living organism. You can't guarantee a consistency from plant to plant. And it's exactly, absolutely, I completely agree. Just like you don't know what child genetics is, are going to come out of two parents. Same thing. You don't know what the genetics are of a plant that's going to come out of, two parents. So, you always hope for the best. You never know what you're going to get though. So, and that's why it's so important to really, and that's why when I work with patients, I rarely work with flower unless they're already flower users, because it is very difficult to play with flower with different patients. However, with edibles or with tinctures, it's much easier to kind of really trigger and get exact dosing. And that's why I always say to patients, exact dosing is what you're looking for, and be very, very careful with edibles. Because I would say if you are not a THC user, do not start with THC edibles. They are not the way to go. They do affect the body slightly differently than you might see in a tincture that does get absorbed under the tongue properly. So you really want to, make sure you're just very, very careful. THC, for those who do use THC, also be careful of edibles. The reason why 10 milligrams of THC is per dose is because that's usually the basic average dose that most people can usually see a large benefit for a lot of ailments. but it depends on the patient. If you're a cancer patient, you will probably need a much higher dose, especially for pain. And if you are somebody who, is cannabis naive or has used a little cannabis in the past, you're probably going to be around 1 milligram of cannabis. So you really want to be very careful where that 10 milligrams, the 5 to 10 milligrams, depending on which state, is a good starting place to say, okay, if you take a 5 milligram, it was a little bit too much, you take less. If you're a brand new patient, never tried a gummy, I would literally not start with anything more than about maybe 0.5 to 1.25 if you've never tried THC before, because that's a low enough dose where it shouldn't really affect you psychologically, but at the same time, it will still give you the benefits you're looking for. So let me just, again, please, anybody, you don't even need to post it. You can feel free just to ask, but let me just make sure, throw it up against, so I just want to make sure I'm not missing anything. Okay, I don't think I missed anything. So the biggest thing, so actually I'm really happy, honey, that you mentioned cost effectiveness, because the one thing I always say, and the great thing, and this is actually pretty much more actually for people who are users, who have been cannabis users for a while. I've actually helped a lot of cannabis adult use, as they consider themselves to be adult use, actually transition to medicinal, because they say, I've had so many people say, oh, I've been using THC flower for years. I always use THC flower. I don't use anything else. And I'm like, okay, great. Have you tried CBD flower? And they're like, why would I take CBD flower? That's just silly. And I'm like, well, have you tried it? And a lot of them will say, hemming, hawing. But a lot of them will come to me because they're like, they will explain to me, oh, I've been on THC therapy for forever. And, and it doesn't, and I have this pain in my back, but it's not really helping that. What do I do? And it's like, CBD is great for physical pain. It's great for physical pain. It's also great for physical anxiety. You can also extend if you're a flower user, you can extend your flower use by using CBD with it, because what you find is it's the same kind of, it's the entourage effect. It's the fact of using things together that that have a benefit higher than each component by itself, and more than just a double effect. So what you find is when you start utilizing CBD with your THC therapy, you need less THC therapy. So you actually can use, if you're a flower user, you can use less flower. If you're a vape or even an edible user, you can actually use less. You can actually end up getting a gummy with CBD and less THC than you're used to. That actually will be more effective, especially for daytime use, than you're used to. And that's specifically because the CBD is kind of, like I said, it's the regulator of the endocannabinoid system. It makes sure that THC is being used effectively. So that's the really big thing about that. So it's really, really, really helpful to use CBD flower and to use other things. Roman, you asked a great question. Yes, CBD absolutely does differ between the cannabis plant and the hemp plant. So the first thing there's technically 3 plants. It's very confusing. If you read many different sources, you will literally get many different answers. But there are 3 plants, really. There's the rudialis, which is, I don't even want to call it the hemp plant. It is a hemp plant. It is what is used very often. But a lot of times what we call the hemp plant is actually still not, it's not actually cannabis rudialis. It is cannabis sativa plant. But there is the medicinal cannabis sativa plant and there is the non-medicinal cannabis sativa plant. The non-medicinal is the hemp. The medicinal has higher, and the way you'll know it is based on the resin. What you'll see is on a hemp plant, you're not really getting as much of that stickiness. You're not really getting the resin or that you would be getting from the medicinal cannabis plant. The medicinal cannabis plant will, and they'll both, mind you, they're both the same species and genus, so they will produce the same types of cannabinoids. But what differs is the quantity and how many and the ratios and everything. So, when you have an extra, so there's both, so I've seen both ways. I've seen a full spectrum CBD product that is 0.3% from a CBD plant. From a cannabis medical cannabis plant. And then I've seen it from the hemp plant. Same species. But what you see is that the effect from the medical cannabis sativa plant versus the hemp cannabis sativa plant actually is much more beneficial. And a lot of patients will say, I don't understand. It's both the same percentage, same milligrams of CBD. It shouldn't be any different. And what you do find is, I wouldn't say it's the CBD that's different necessarily, but it's the other cannabinoids and the other phenols and the other chemicals in the plant that naturally get extracted is what you're actually getting more benefit from than the CBD alone. So it's, again, more of an entourage effect and more effective from the medicinal plant than alone. It also depends on what the carrier is, and carriers what formula or solution you put your product in. So MCT oil, which is also known as coconut oil, is very good to extract cannabinoids from the plant. However, our bodies don't really metabolize coconut oil well. It's not as bioavailable. I mean, we metabolize it, don't get me wrong, but it's not as good as your body's not as good as taking the cannabinoids out of the MCT oil as the cannabinoids were able to go into the MCT oil. So you really want to be careful, because I personally will always recommend an alcohol-based, and I don't mean alcohol-based meaning it tastes like alcohol, but when the extract was done in an alcohol-based, meaning that they used alcohol to remove the cannabinoids, there is potential stripping of the cannabinoids, which I know some people will say, but it strips cannabinoids. It does, but what you find is it actually enters the body better and you feel a bit more effect from it. So I always do recommend to see if there's plenty of CBD oil out there. I usually say if you can find a CBD tincture that is, originally an alcohol extraction, you're going to find more benefit from it than you will from something that is extracted from an MCT oil. So it's, and that's what I find as well. So you just got to be really careful where you're going from. Also, olive oil, it gets absorbed. The only problem is olive oil also is very, very thick. And a lot of people don't want to put it in their mouth and then swallow it, because again, it's very, very, very thick. And some people are really great about it, but I personally, olive oil extractions are very effective, but I personally can't get down olive oil. It's really good, mind you. It's very good for your HDL. So for those of you who would like olive oil, it's really good it increases your good cholesterol and it decreases your bad cholesterol. So it's great for you. It's hard to get down. I always, when I was doing that, I kind of had to chase it with something citrusy to kind of get the oil out of my mouth. And it's the same thing. So that's why I like alcohol-based. Alcohol-based usually comes in, it's not, the whole thing is not alcohol. It's usually like zero, it's alcohol-free type thing, like solution, but it's more of like a very, very, very thin looking oil usually if you get it. And it actually, you can feel it penetrating underneath your tongue, which is great. So any questions? Because, oh no, I lost my camera. I must be losing bandwidth. I'm happy to answer any questions. Tanya, thank you for joining. I know you were newer to the call, and thanks, Roman, for your question, and Sherry, thank you for your question. But I'm happy to answer any questions that even I didn't go over. I know I kind of sped through it real fast, and I know there's lots of information, but feel free, because and for those of you who are new to cannabis therapy, start low, go slow, start low, stay low is really what we say, and definitely start with the CBD full spectrum therapy if you can. And again, I have my information in the chat. Please feel free, reach out anytime if you're like, hey, I was looking for a product. This is what I saw. Any recommend, is this good, bad, ugly? Let me know, and I'd be happy to. I'm better at the what not to take than what to take. So, I could definitely tell you what to stay away from. But again, all in all, like the point of the therapy is everybody has a different endocannabinoid system. It works differently for everybody. So you have to remember that what might work for somebody else might not work for you. So you need to listen. This is the type of therapy to really listen to your body. If your body says, I'm too dizzy, too much THC. If your body says, I'm too energetic, usually too much CBD. And also, if you start if you don't have any THC therapy and you're on CBD and you're taking high amounts, it can also start causing you to be a little sleepy. So just be careful, you know, and just see how your body feels. If your body feels great from taking a certain product, there you go. Then you've met your endocannabinoid. So, you know, thank you so much, everybody, you know, and if there's no questions, I'm going to send it back over to Linda.
Okay. Well, thank you. That was so informative. I always learn so much from your presentations. And every opportunity I have, I always want to get on and hear whatever you reviewing for us. And that was just so comprehensive. And I want to thank you again, Dr. Leah, and everyone for attending.